Welcome to Physicians Keepers. Each episode features honest conversations with physicians, sharing moments that shaped them, challenged them, or taught them something worth passing on. These stories come from every corner of a physician's life: the clinic, OR, family, finances, mental health, leadership, and personal growth. If a story can help another doctor feel seen or strengthened, it belongs here. It's about honesty, courage, and community true storytelling. If you are looking for connection or a reminder that you are not alone in navigating this profession, you are in the right place. Hello and welcome to another episode of Physicians Keepers. I'm so excited to have you here today. If you're watching on YouTube or you're listening on Spotify, it's an absolute joy. My voice sounds weird. I'm just recovering from a cold, so bear with me. But we're going to hear mainly from our amazing speaker today, Dr. Maiysha Clairborne. I'm just excited to have her here. She is amazing. She is she's accomplished quite a lot, and I'm going to read out her bio here so you can have a good sense of who we are talking about and who's going to give us a conversation today. Dr. Claiborne is an integrated physician coach, and she is the founder of Mind Remapping Company, and she helps leaders and organizations build psychologically safe, trauma informed, and trust centered cultures using her REMAP framework. Her impact spans from corporations, hospitals, and major healthcare systems to educators and school administrators. A two-time TEDx Asheville speaker, she hosts the podcast Beliefs, Behaviors, Communication, and the Brain, and is the author of The Wellness Blueprint and co-author of The Conscious Anti-Racism. Thank you so much, Dr. Claiborne. You've accomplished quite a lot, and so we're so glad to have you here today.
Thank you, Dr. Ali. I really, really appreciate bringing me in, allowing me to have a conversation with you, and allowing me to be able to provide value to your audience today.
That's I'm sure, like I said, you come with so much wealth and experience, and I'm sure that every nugget we hear from you is going to be very valuable.
Mhm.
So, you often say, we're going to go kind of behind the healer behind the physician, because you often say that you are a healer first.
Yeah.
And when did that identity begin for you? Before the titles, before the degree? Like, when did you start having that sense of who you were?
Oh, it's such an interesting question because I think that I don't know that I've ever been asked that specific question. And when I think about my childhood, so I'm an oldest child. And when I think, if I really think about it, it probably began back then when you're an
Yeah,
oldest kid and raised by a single mom primarily. You
yeah,
become that go-to person, right?
true.
And so I was always the one taking care of my sisters, and when my mom would be working and maybe something happened and they fell, then I'm the caretaker. Like, I'm always taking care of the kiddos.
Yeah,
And so I think, you know, consciously, I think that probably came to me in college, but I think unconsciously I had been living that role for most of my life. The person who was the caretaker, the person who people would come to in order to, I was like that listener that people come to with their problems, and the person who held space for people. Like, I think I was sort of always that person when I think about
yeah,
it. I think consciously, when I was graduating from college, I was introduced to yoga. And I think I've always sort of been someone who goes against the grain, right? I do the things that other people don't do,
yeah,
and so when I learned about yoga, I started to go down this sort of rabbit hole of what else is there in the realm of healing. I
yeah,
already knew I was going to medical school. I had already been accepted, but I was like, oh, there's something more.
yeah,
And so I started to learn about things like traditional Chinese medicine. I started to learn about things like energy healing, and became trained in these things. And
yeah,
I think this is where I probably started to take more the identity of healer on, is like right as I was beginning to enter medical school, because I already knew that even though I was going down that traditional educational path,
yeah.
that my career path was probably going to look different.
That is awesome. Now, from what you're talking about, it means that you knew that you kind of already knew this wasn't, you didn't get to that point while you were practicing medicine that you felt you were going to do something different. It
Mhm.
was something inside of you that said, okay, I, what I have is bigger
Mhm.
than medicine on its own. So what was that defining moment for you? Because if I'm, do you, you're not, you don't practice clinical medicine anymore, right?
That's correct. That's correct. Yes. And what's interesting is if you had asked me when I was in residency, even if I thought I would leave clinical medicine, I'd be like, what are you talking about? So even we'll get to that part of it, but like even that is something that I was led to. And I think to answer your question, you know, whenever I'm asked these questions, I'm always in reflection. It's, like evolving reflection. And I really feel like I've been led throughout my career, right? So for me, I think the moment I knew that my path would be different was when I was graduating from college. Someone gave me this book called Between Heaven and Earth, and it was about the traditional Chinese medicine, the five element theory, and some of these different types of approaches to healing. And it was so intriguing to me because I already knew I was going to med school, but I was like, wow, there's so much more to healing than what I'm being shown. I don't know how this is going to show up in my career, but I know that it will. And it was, I think that was the defining moment when I
Yeah.
knew that my path was going to look different, even not even knowing how.
Yeah, yeah. But it's amazing, like I said, that you embrace that part and you were actually even open to that because a lot of times as physicians, there's certain callings or pullings that we have at different choices, but we tend to like just shut it down and we tend to like just, no, I'm just gonna stay focused on the clinical career because this is all I've been trained to do. So we don't even give room for expressions of what alternative pathways, so to say, could be. And so then sometimes we find ourselves locked in this box where we've practiced medicine for so long and
Yeah,
we didn't explore what other options could be open to us. So,
yeah.
I mean, you did that. And so that, I mean, said the fact that you already had that mindset initially was, I guess that was a great advantage for you because it
Mhm.
kept you open-minded. It kept you
Yeah,
open-minded to learning.
I have to thank my mom for that because I watched my mom build a dental practice from the ground up.
Wow.
So one of the things that people who follow me know about me is that I grew up in a home witnessing domestic violence for a large majority of my young life,
Oh,
and my mother left her abuser, who was my stepfather, not my biological father at the time. She left when I was in the seventh grade. And I remember um, we went, we drove up to, so I grew up in Huntsville, and about maybe 30 to 45 minutes north was Fayetteville, Tennessee. And I remember driving to Fayetteville, and there was this old house, and she had purchased this old house in Fayetteville, Tennessee, and she ended up fixing that, and that was her first practice.
oh,
And
wow.
so this was a practice that I watched her build. I watched her like the physical, like the
Yeah, yeah,
remodel,
yeah.
and then I would work in every summer from the eighth grade until I graduated. And so it was and then she ended up opening a second practice a little bit closer to where we lived.
Yeah,
But just like to watch her do that, I think that was kind of like that um, unconsciously infused something in me.
yeah,
And so I have to thank her for her innovation and for what she modeled, that if there's not something that's created, that you create it.
yeah, yeah. And like I said, it's amazing, like I said, just from what you said, because I mean, as human beings, it's easier to dream and to expand your thinking when you see someone in front of you doing that.
Yeah.
Where it's like, oh, it's possible for them, then okay, it's possible for me. And it's
Mm-hmm.
something that I'm from Nigeria. One of the common things that our parents tell us, we every Nigerian can relate with this is if someone comes in, you bring your homework and it's like, what did you get on this assignment? And it's like, oh, I got a 97. The first thing they would ask you is, okay, what are the person that got the highest score, what did they get? And you're like, okay, they got 98. And then your parents are like, well, do they have two heads? You all got one head. If they if they did it, you can do it. So just something
Yeah,
about seeing someone
yeah.
who has done it,
Hmm.
gives you that mindset that I can also do it too. Now, leaving clinical medicine, as every physician will know, it's not just a career decision. It's an identity shift. Like
Mm,
it is. Because this is something that you've worked hard for, you've been in the trenches for, you kind
right.
of built an identity around. Like,
Yeah.
what did you have to let go of to become a different type of healer?
Well, the first thing I had to let go of is I spent all this money and all these years to get this degree. And now what, you just gonna like throw it away? And I'm still in debt. Right? So that's the first thing I had to let
Yeah,
go of. Like,
yeah,
woo, well, you wait, did you just waste your money? But for me, I think how I got across that for me was that what I was moving toward felt like I would say like a leveled up version of what I was doing. So I moved out of clinical medicine to coach other clinicians, to coach other moms in medicine. And so for me, it was a reframe of, well, if I am healing the healers, then how many patients am I impacting?
yeah,
So in
yeah,
essence, I was just, leveling it up a little bit, right? So
yeah,
then that helped me to to get past that aspect of it. I think the other thing was recognizing that I did the work to become a physician. I will always be a physician, right? And so like sitting in that, like people would be like, well, so you're not going to be a doctor anymore? And I'd be like, yeah, I'm gonna
yeah,
always be a doctor. I'm gonna always have the knowledge. I'm gonna always have the credentials, right? I worked for that. I am just doing something different with my degree now. And what's crazy for me is that I have been out of clinical medicine since, I think the last time I officially saw a patient was 2021, but I left my practice around 2020, right? So when the pandemic happened, it was sort of
yeah,
like
yeah.
excuse. And I sold my private practice
Oh,
in
wow. So you had a
2017.
private practice.
Yeah, I had a private practice. And so I let that go in 2017, which, if you can believe, now next year will be 10 years, and started my coaching practice in 2016. And so, that I just realized that in September, I'll be 10 years in
10
my,
years. Oh, wow.
yes. But I think that the I still maintain my license. I still maintain my board
Credential.
certification,
Yeah,
because in the back of my mind, I'm like, well, what if I want to do like medical mission? I'm clear that
yeah,
I'm probably not going to come back and practice regular medicine. I mean, although
yeah.
I guess I could, but if I want to do like mission work, medical mission work, like that's something that still is in my heart,
In your heart.
that I'd like to at least have a license so that people can say, oh yeah, she's still licensed and board certified.
But that is awesome. I mean, like I said, I'm glad that you gave yourself that. I mean, you're able to see past the limitations of just MD, right? And then you transition to this space where your dream became bigger,
Mm-hmm.
right? Where it's like, okay, my impact is actually more,
Mm-hmm.
right? At this point in time, if I can impact the physicians who then see the patients, and
Yeah.
that's a bigger dream than where I am. So that's awesome. And I'm glad, like I said, that you listen to that, because a lot of physicians who feel that call to do something greater or something bigger, but then there's the fear that comes with it, the uncertainty. I mean, you even mentioned that you left and you had all this debt, right? Because sometimes it's like you say, okay, well, let me pay off
Mm-hmm.
my debts and be,
Mm-hmm.
financially buoyant before I
Mm-hmm.
step out into this dream,
Yeah.
right? And then dream is there, it's and time is passing, but you took that leap of faith, and it's open doors for you, it's open stages for you, right? You're a two-time TEDx speaker. I think your last um I'd already started watching your second TEDx, yes, and it's just so amazing. You already have like 17,000 views on YouTube. So I
Thank
believe
you.
that all this, like, it's just with you saying yes to
Mhm.
what else could possibly be out there, and that's what led you to where you are. So that's amazing. Now, where you want to say?
Yeah, I was just gonna say, there is a flip side to all of
Yeah,
this, right? Because I think that sometimes when we do the things that we do, we present the way we present, people think it's easy. And so what I want to say is that there was a cost to my path.
yeah,
And there were times, and I'll share just a little bit about that. There were times when I was like, why couldn't I just be a normal person and get a normal job and make my six figures and call
yeah,
it a day?
yeah,
Right?
yeah,
Like this is something that has come through my head many times. And I mean, even as recent as in the last 6 months, sometimes I'm just like, man, because
yeah.
entrepreneurship is not for the faint of heart.
No, it
Okay.
isn't. It isn't.
So even like going into private practice as an integrative medicine doc, back in the day when this was like back in 2004, when what I do now was called alternative medicine,
Mhm.
right? So it was difficult to grow my practice, and I was doing cash based medicine, which was not a thing back then, right? So
Yeah,
trying to convince people to pay their money to
yeah,
come see me to do something alternative to what normally, people, it was a good idea for them,
yeah,
but
yeah,
like
yeah,
to execute that was like, I don't know if you don't take insurance, what? So like there was that struggle. And
yeah,
then once I built the practice and the practice was doing well, and then I was like, you're going to leave that to start over? And there was a cost to that, right? Like I can't see myself having done it any differently from the standpoint of my path has given me who I am and I love what I do. And there has been a cost.
yeah,
And that some of that cost has been financial, some of it has been, stress, but the upside is the freedom to be who I
yeah,
want to be, right? To be
yeah,
fully expressed in my career.
yeah,
And then to start over, not to start over, but to make a third transition from being a coach to now working with organizations, which is an entirely different path. And to be clear, I do still coach one on one. That's my first love. I do group coaching. We'll talk about that, but like that's my first love. But to transition and expand into business to business or business to corporation, that's a whole nother monster that
yeah,
I wasn't quite ready for until I was.
yeah, yeah,
And so I just want to share that, like it's when you choose this path, there are two sides of it. There is the freedom of expression to be who you want to be, to do what you want to do, to live in fulfillment of your purpose and career.
yeah,
But that also, if especially for someone like me who never worked in a traditional hospital system with all the different connections and titles and all of that, like I never did any of that.
yeah,
And so I feel like that made my path a little bit more challenging because of that, because I literally had to build my brand, build my name, become known inside of a community where I felt like I was an outsider.
yeah, yeah, absolutely. And I mean, you mentioned that you started coaching as far back as 2016, which at that time, it wasn't as popular as it is
Yeah,
now. Like, I mean,
absolutely.
I would admit that I didn't know much about coaching till the pandemic. You
Mm-hmm.
know, it was like I stumbled into that world of coaching. I'm like, oh, like there are coaches everywhere, like physician coaches. Like I didn't even know it was a thing. So
Yeah.
I can imagine for you, like being like a physician and pioneering into that space,
Mm-hmm.
how that would have been kind of a lonely journey for you. I'm sure there were not a lot of you at that
Mm-hmm.
time. Now it's more acceptable to say I'm a physician and I'm a coach.
Right.
But back then it was like, no, you can't be both. Like pick a
Right.
lane.
Right. Right. They're like, what is that anyway? You're not a psychiatrist. Like, what are you, a coach? Like, what is that? you know,
But
I
yes,
don't need a coach. Everything's fine. Everything's fine. I don't need a coach, right? I mean, it was something. It was definitely something.
Well, I'm glad that I'm glad that you persevered. So now you like just kind of from your story, you help organizations now to create cultures where people feel seen, heard, respected, and psychologically safe.
Mhm.
Was there a time in your own career where you didn't feel those things?
Oh, absolutely. And that was very early on in my career. So even from residency, one of the things that I don't talk about as often, but I do talk about it is that, through my in the beginning of my residency career, I started to experience clinical depression. And as you know, there's still a lot of stigma around mental health in the medical community. Back then, even more so.
Yeah.
And so, like, I never felt safe enough to tell anyone except for two people in my residency class. Thank God for those two people, because if it weren't for them, I actually may not be here. Like, these are people I picked up the phone and call at my deepest, darkest hour,
Oh
right?
wow.
People who held me and were checking on me, until I came to the point where I felt like, okay, I'm better,
Yeah.
right?
Yeah.
But I would not go to the psychologist on the floor because I didn't know, like,
You
would
didn't
she
trust, yeah.
understand? Who would she tell? Would
Would that
I be
reflect on you
sidelined?
as a resident if you're not
Exactly,
capable
exactly,
enough to
exactly,
handle, yeah,
exactly.
yeah,
Yeah. And then, so coming through that experience, what I learned was that, well, number one, you can't be different. Number two, especially as a Black woman. But number three, you just gotta like persevere and push through. And so fast forward into my clinical career, being a physician who kind of colored outside the lines of what other physicians were doing. And I would go to conferences or I would go to networking events thinking, oh, maybe we could form partnerships where we refer to one another. And these folks looked at me like I was crazy. And so it just reinforced, like, you can't be different. And so, like, I didn't essentially feel safe in my own community of colleagues.
yeah,
Where I found that safety was with chiropractors, with therapists
yeah,
who kind of got it. And then, of course, there's the I don't know how it is now, but I know there's always the listening that physicians had of chiropractors. Like, okay, well,
yeah,
I don't
yeah,
know
yeah,
about that. Are you partnering with them? Oh, are you really like that, right? And so it's been an interesting journey of feeling excluded in a community where I should belong,
yeah,
and then now recognizing that's happening right inside of organizations. Because in 2020, I put my social justice hat on, and it widened my view, like, okay, I'm not alone, even though I experienced it a little bit differently.
yeah,
Like, and I know what it feels like. The way it's happening inside of hospitals and healthcare organizations is a completely different, and dare I say, even more toxic and stressful thing.
yeah, yeah. Oh wow. I mean, your work with that is has been phenomenal. So, um, I'm glad pretty much that that's something that you are embracing because as someone who also went through a depressive state in residency, I know what it feels like when you feel like you can't talk to them. You don't even know who to trust, right?
Yeah.
Because it's like, okay, there's this, employee assistance program that's supposed to
Mhm.
help you, but you don't know, you don't trust. This is an
Mhm.
individual you don't know. It's like, okay, am I safe there? Right? Is
Mhm.
can I express what I'm dealing with? And then, I mean, I didn't know when I was dealing with depression, I didn't not even know. Like I'm a physician and I'm
Mhm.
surrounded, and the amazing is like I keep thinking about it. I was surrounded by 20 plus physicians who see me every single day.
Mhm.
No one near was depressed,
Right.
until I had like a full-blown panic attack in clinic
Mhm.
before it hit me. I was like, oh my God, I'm anxious. Like this
Mhm.
is what this is. So
Mhm.
I think it's so important that organizations, when it comes to psychological safety, especially in the physician area, in the physician community, because the standards are different for us, so to say, and they shouldn't because we're human.
Yeah.
At the end of it all, we're all human. Where's like
Yeah.
okay, you're supposed to show you're strong, you're not supposed to show you're stressed, but
Mm, it
it's a
is.
stressful process with training. I
Yeah.
mean, and we make it so normalized. We normalize stress. We
Hmm.
normalize, we normalize all these things and they don't help.
Right.
You keep bottling all these things up until something bad happens, right? And
Yeah.
that's where the story comes, oh my God, we didn't know she felt that way,
That's right.
and then at that time it's already too late. So I'm really glad that you had that support system on
Hmm.
you that kept you,
Hmm.
because not a lot of people have that. So I'm grateful for that for you. Yeah. So another thing that you teach, and part of you teach that communication can either build bridges or burn them.
Yes.
Was there a conversation in your life that changed, that kind of led you to that realization?
Yeah, I would probably say that in my early years that I was I was the queen of burning bridges. And I didn't burn them like sort of from this, like I didn't burn them toxically, right? I just cut people off. I would just like leave high school and like, okay, door shut, locked. And then I left college and I was like, okay, door shut, locked, right? And or I would have conflicts and I'm like, okay, door shut, locked, and I would keep moving forward, right? That's that was, I think, all my nervous system knew how to do.
Yeah.
And I think part of that was, for me, conflict was like what it looked like when I was in an abusive environment. So
Yeah.
I was like,
Yeah.
oh, we're not going to deal with that. So any trouble with me, door shut, locked, I'm out. Right? But then I think that there was a point in my personal development where the mirror was shown at the cost of that. What was the cost of me just door shutting and locking and moving forward? And I think that was the place or the time where I began to learn how to have these conversations to reconnect bridges that had been sort of like maybe not built, but like not maybe not burned, but broken, right? They were just doors locked along the way.
Yeah.
And and I had retrieved and recovered some very beautiful relationships. And there were some, and in fact, the man who was my stepfather, who was the abuser to my mom, I was able to actually have a conversation with him to complete for myself, like
That
to complete and heal for myself and to understand what what was he going through during those times, not to excuse his behavior, but to recognize that, this was a Vietnam vet going through PTSD, then who was, a person who was addicted and, like that,
Yeah.
hurt people. And so I think that for me, engaging in that work to realize, and I think it came to that because I started to notice I was hitting a wall with my business. And I thought it was just my business, but it wasn't just my business. Because I say how you do anything is how you do
Yeah.
everything,
Yeah.
right?
Yeah. Yeah.
So
So
I
that was
think
the one.
that's what connected the dots for me.
That is awesome. Now, you work a lot with physicians and also
Mhm.
even from a coaching standpoint. What for physicians, what would you say that they carry that a lot of silently carrying that few people recognize just based on your experience for us as physicians? What are the silent struggles that we deal with that a lot of people don't recognize?
Oh my gosh, there are so many. I'll start with we carry the weight of whether or not, like, first of all, we carry the weight of people's lives in our hands, right? So I think a lot of people think that when we leave the office, we just stop thinking about our patients. We're like, oh, clocking out, our brain clocks out. No, we carry every patient that we've seen with us. did I prescribe the right amount of medicine? Was this the right decision that I made? How is this person doing? Like, ooh, I wonder how my pregnant woman, how she's doing. Like, how's that baby growing? People that we no longer see, we think about. So we carry all of our patients with us. There are even today, almost, 7 years out of medicine, and there are still patients I remember very vividly, ones that are still here, ones that have passed, right? And so that's one thing. I think we carry the weight of having a feeling like we have to have it all together all the time. We have to be strong because we have to be strong for our patients. When we walk in the door, we have to be on. When we walk out the door, we have to be on. When we walk out of our house, we have to be on because we're representing, a certain image. And so, like, we carry that, which means that, I mean, we're human. We get divorced, we have babies, we have mental health stuff, struggles. We're caretakers, we have kids, and we're not the perfect parents, and like all of those things, right? And so we are human, but when we carry this thing that we have to have it together all the time, there's some cognitive dissonance around that. And I think a lot of people don't see that.
Yeah.
And a lot of people don't see when we struggle with our mental health.
Yeah.
And I think that's why, we have what we have in terms of the statistic of, 300 to 400 docs that we lose by suicide every
Yeah.
year, every single year. That's when I heard that statistic. I think when I heard that statistic, that sealed in me who I needed to be working with, right? As a coach,
Yeah.
as a healer, because that's like a doctor a day,
Yeah. Yeah.
and that's
It is.
crazy.
It is. It is. I mean, like I said, it's where, and then, like I said, the narrative is they were surrounded by other doctors,
Mm-hmm.
right? Who it comes as a shock to them when this
Mm-hmm.
happens. It's like we did not see it.
Mm-hmm.
Like because like I said, sometimes we've been taught that we can't show vulnerability, right? So
Right.
it's that encounter where you're moving from one patient room. You just gave this patient the most devastating news of their life, right?
Mm-hmm.
You were with them in their emotions. I mean, you felt their pain, but
Mm-hmm.
then you have to walk into the next room and tell
Yes.
the other patient to smile and to be like, "Hey, how are you
Mm-hmm.
doing today?" Like
Mm-hmm.
you have to, but then you're still trying to lock those emotions that you felt and not to show up, right?
That's
You
right.
lose a patient, and then you hear this devastating news, but you still have to go to the next room and you can't
Mm-hmm.
cry. You can't be
Right.
crying to a patient. It's like, and
Yeah.
so we bottle all this up. And I think that's why it's important for physicians to have these, spaces or spaces where they can
Mm-hmm.
feel vulnerable, just don't be isolated, right?
Yeah.
Anything that's happening to you as a physician is likely happened to another physician.
Yeah.
Like it has, you're not the only one going through all the thoughts and all the whatever is going on in your head. Someone else has dealt with it. So learning how to be open and be vulnerable and just hearing from other people how they overcame it, or just to know, hey, we're in this together.
Yeah.
I think it's great. And like I said, with coaches, right? And so when they step into this realm of coaching, where they're
Yeah.
able to process their feelings and they're able to learn how to
Mm-hmm.
navigate all these different emotions and the different, I don't say burdens, but just responsibility that medicine places on you. I think it's such an amazing thing that happens with coaching too.
Yeah. Yeah, and I want to speak even more specifically to physicians who enter leadership, because I think that's another space where there's then an additional burden to carry, because then you're responsible for like your colleagues, and it's almost like being a parent, even though you're not a parent, but it's like you're like there's an additional responsibility, right? And so I think that the higher, and especially if you are a woman, if you are a woman of color, a Black woman, and you begin to rise in the ranks. And I just had a call with a young woman who is like, ear to the CEO, and a dot in on the team, right? A
Yeah,
brown
yeah,
dot on the team. And the things, the additional burdens that come with that, the additional subtle acts of or overt acts of exclusion, the attitudes, the undermining, all of that, those are additional things that women who are in leadership, that, Black physicians in leadership, man and woman, but particularly when Black women in leadership experience. And I think it's important to name that because it gets lost. It gets lost in the sea of what we all carry. Then there's additional burden the higher you go in an organization. And we, as women of color, as Black women, we carry an additional burden in general inside of the medical space.
Yeah, yeah. I said I'm glad, like I said, that we're having conversations about this, and you're having a conference coming up. Can you tell us a little bit about that?
Yes, yes. So one of the things that I do inside of organizations is I run these coaching cohorts, groups of physicians that matriculate through my trauma informed communication course. And so I thought, well, this is wonderful to be able to do this inside of an organization, but I want to create a safe space for women in leadership, which is why I talk about it so much, who carry these additional burdens, who may not be a part of the organizations I'm working within.
Yeah,
So I have a cohort I do that I'm starting a standalone cohort for women and physicians in medicine and leadership, and that's going to start in the fall. And it's a 4 month coaching safe space small group, about 10 women that'll be able to share their wins, share their struggles, while earning continuing medical education and learning expanded ways to communicate and navigate the things that they experience that
yeah,
activate their trauma, right?
yeah,
So that's what's coming up, and so I'm looking forward to. I'm very, very excited about this cohort and hoping that over the next year, I do 3 a year. I do a fall, I do a winter, and I do a spring. That over the next year, we're going to start to see more and more women on a wait list to be on this cohort because they need it. They need
yeah.
it.
Absolutely, they do. And like I said, I'm so glad, like I said, that you are in the space and you're creating this environment for this to happen. So thank you so much for that.
Yes.
Now, before we close, I would like to ask you, what would you say to a physician who knows that they are being called to something bigger, but they're afraid to leave what's familiar?
Listen to the knock. Listen to the knock. Because if you know you're being called, if you feel you're being called, then it to not examine that will lead to like sort of an incongruency of values, which will ultimately impact your experience of yourself and your experience of your career. And it doesn't mean that you have to like shut the door and walk away from your career immediately, but start to explore that. And I mean, this is where we explore with coaches. Is when you start to have an idea, you want someone to bounce it off of, accountability partners, mentors. I think I would definitely I would definitely recommend exploring that knock and what that is and what that could be.
Yeah, yeah, and that's amazing because we do underestimate the importance of mentorship in medicine. I think we need a whole lot more mentors. We have a lot of teaching physicians,
Yeah.
attendants, as we call it, but then
Mhm.
there's that mentorship gap that is
Mhm.
missing a
Yeah.
lot in medicine. And I think there are a lot of challenges that as physicians, what would have helped a lot of physicians is just a mentor.
Hmm.
And like I said, that can come in the form of a coach, an accountability partner. And
Hmm.
so there are folks like you doing amazing work with that. And
Hmm.
so right now, I think medicine is going to be in good hands in the future,
Yeah.
just based on the work that you all are doing.
Oh.
So thank you so very much. Now, before I leave you, when your career is over, what do you hope people are going to remember? Not about what you accomplished or how you made them heal. What do you want them to take
Mm.
away from their work with you?
Oh, let's see. What I um when I leave this work, when I totally leave this work, I think what I want people to remember for themselves is that no matter what is going on, there is always a community for them, right? There's always a community for them, and then they don't have to do anything alone, right? They don't have to do anything alone. I think that if I could instill that through the communities that I've cultivated, um, I think that would be a really beautiful legacy to leave.
Oh, that's awesome. Totally agree with you on that. But Dr. Claiborne, it's been awesome talking to you today. I'm sure that anyone who's hearing has gotten some valuable nuggets. And if folks want to reach out to you, where can they find you at?
Sure. Well, so I live from a social media standpoint, I live mostly on LinkedIn. So you can find me on LinkedIn. It's LinkedIn and then a backslash Dr. Maiysha. If you want to learn more about my work, you can go to my website. It's mindremappingacademy.com. And when you go there, you can see my TEDx talk. You can learn about the REMAP cohorts that are coming up. You can learn about all of that. And finally, you can listen to the podcast if you want to get more of a sense and a feel of my energy and what I talk about, beliefs, behaviors, communication, and the brain. So those are 3 steps you can take. LinkedIn, check the website out, listen to the podcast.
Awesome. I will definitely include all those notes in the show notes. But you've been an amazing physician's keeper today, Dr. Claiborne. I am
Thank
so
you.
excited to have had this conversation with you. I can't wait to go finish. I need to go finish listening to your TEDx talk. That's a whole different discussion for another day, how you got on that stage. Because yeah, I mean, you all are so bold, and I'm always in awe when I see folks because yeah, it's never a thing in my mind, like just being in a room of strangers and talking. So you're amazing, and thank you
Thank
so much for
you.
that. So if you've listened to this conversation, if you've liked, please give us a thumbs up, like, share, subscribe. This is Physicians Keepers, what we do. We talk to amazing physicians. We hear their stories, the passion behind their journeys, anything that can help another physician feel supported and seen. And if you have a story that you want to tell us, you can always send me a message, drremolo@gmail.com. We're Physicians Keepers. We're on Instagram, Facebook. We're getting there. Sometime we'll get there. Getting there. We'll probably have a page at some point in time. Yes. And then if you're listening to this, if you're a mom, and this is me doing a shameless plug, ages 6 to 10, I wrote a book. My book is out now. It's on Amazon. It's called Captain Cardio on the Heart Ranch, and it's an amazing kids book. It just teaches kids ages 6 to 10. We use a superhero, Captain Cardio. He
Mhm.
just teaches kids how the heart works, how blood flows, how to keep their heart healthy, right? Because we want healthy kids. We don't want to have to deal with
That's right.
and patch up adults in the future,
That's
right?
right.
Because they've already, now they're coming burdened with heart disease and whatnot. And so you can grab yourself a copy. It's on Amazon, Captain Carter and the Heart Ranch. It's the first in the series Bodyville. And then also there's a free activity pack, if you want to go over the book with your kids. It's like a comprehension pack on bodyviewbooks.com. There's a coloring, and all that. So keep your kids engaged in the summer, get them away from those games, and then get them studying, and you may create a future doctor down the line. But thank you. It was
Yes.
a pleasure. Thank you all so much for listening, and we'll see you on the next episode.
Thank you.
Thank you for listening to Physicians Keepers. I hope today's conversation gave you something useful to carry into your life or practice. If it resonated, share it with another physician who might need it. And if you have a story that could help someone else, I'd love to hear from you. Connect with me on social media or send me an email. See you in the next episode.